Today we're going to talk about vaccines. What is a vaccine? Have you ever heard anyone say that as soon as you get chickenpox once, you can't get it again? That's because every time your body fights an infection, it triggers your immune system to launch defense mechanisms that help protect you from getting that same exact infection again in the future. Getting a cold every once in a while is no big deal. But there are some infectious diseases that you might want to be protected against without ever having to get sick in the first place. There's a solution to this problem: vaccines. So, how does a vaccine work exactly? When you go to the doctor to get a vaccine shot, the doctor is actually injecting you with a small amount of deactivated germs, such as viruses or bacteria, that won't cause disease. These signal your immune system to start producing specific immune cells and antibodies to attack the germs, which will then protect you from getting the infection when the real germ attacks you in the future. Plus, you never even had to get sick in the first place. Vaccines make you immune, or immunize you, to certain diseases. This is why vaccines are also called immunizations. Vaccination is one of the easiest and most effective ways to prevent and protect yourself and others from getting sick from contagious germs. Now, you might be wondering, are vaccines safe? You might be wondering if it's dangerous to get a vaccine. What if the weakened germ isn't weak enough and you end up getting sick from it? Or maybe you're wondering if vaccines can have other unwanted side effects. Luckily, for most people, vaccines are completely safe. They're tested for years to make sure they're safe and effective before they become available to us, so you shouldn't worry about getting sick from the germs they used to make vaccines. You might have also heard stories about vaccines causing very serious side effects, like autism, a fairly common developmental disorder that affects behavior and communication skills. But these stories are just myths, and multiple studies have been done that all show there's no link between vaccines and autism, or any other similar disorder. However, like almost any medication or medical procedure, vaccine side effects can happen. For most people, this means your arm might feel a little sore or bruised where you got the vaccine, and you might feel a bit under the weather for a few days afterward. In very rare cases, people can have allergic reactions to vaccines. For example, some vaccines contain eggs as an ingredient, so you are always asked if you're allergic to eggs before getting a vaccine. If you notice that you feel funny or sick after getting a vaccine, you should call your doctor just to be safe. Let's talk about some examples of common diseases vaccines can help protect you from. First, let's talk about the HPV vaccine. It protects you from human papillomavirus, which can cause genital warts and certain types of cancer, including cervical cancer. Doctors recommend getting this vaccine when you're 11 or 12 years old, or sometime during your teenage years. The flu vaccine. It protects you against the influenza virus, also known as the flu. It causes symptoms such as fever, cough, runny nose, and many others. The recommendation is to get vaccinated every year. The flu might not seem like a big deal, but it's much more serious if you spread it to young children and the elderly, and there have even been cases where it has killed healthy teenagers. The tetanus vaccine. It protects you against infections caused by tetanus bacteria. The infection can cause painful muscle cramps and sometimes death. You're usually exposed to the bacteria in dirt, dust, or rusty metal, and it usually enters your body through cuts or scrapes. Doctors recommend that you get a booster vaccination every few years so that you stay protected against tetanus. Remember, there are many more vaccines you can and should get by seeing your doctor. Many times, they can combine multiple vaccines into one visit, which makes it extra convenient to get vaccinated. So, which vaccines should you get? And how can you get them? There are many different vaccines that doctors recommend getting from birth onwards. Some of them take multiple doses to become fully effective, and you probably already got some of them as a baby. You can find the full list of vaccinations you should get at the United States Centers for Disease Control and Prevention website at www.cdc.gov. It's a good idea to have a complete immunization record that contains a list of all the vaccines you've received. Ask your parents and doctor about which ones you have received, and check to see if and when you should get any vaccines you should have gotten but might have missed. Your health insurance probably pays for most or all of the cost associated with vaccines, but if not, there are programs that can help you get the vaccines you need for free, such as the Vaccines for Children program. So, what happens if you don't get vaccinated? Maybe you think getting all of your vaccines takes too much time, or maybe you're afraid of needles. Or maybe you think that young, healthy people like you probably won't get sick anyway, so why bother? Well, if you decide not to get vaccinated, you're not just affecting yourself. You can end up spreading the infection to those around you, including people with weaker immune systems, like babies and elderly people, or people with certain pre-existing health conditions. Even if you don't feel like you've gotten sick, you can still spread infections to other people. This happens more often than you'd think in daycares, schools, and nursing homes. All of this could have been prevented by getting vaccinated and preventing yourself from getting sick in the first place. So make sure all of your vaccinations are up to date. Thank you for watching.